So now I'm back again to tell you more about the basal insulin and how to titrate that. So how to make the calculation and how to titrate it. But I'm gonna as well bring again Professor Mahmoud. So hello again, Professor. How are
Hi,
you?
I'm very good.
So you're gonna tell us now how to calculate the basal insulin so that people are aware more how to calculate them and how to titrate the dose.
Okay,
Do you want to
great.
show us maybe an example
Okay,
quickly?
yeah. So basically, when we are going to initiate basal insulin on a type 2 patient, this is what we do. So there are two ways of initiating basal insulin, and giving you a little bit background. Who are the patients who are going to require basal insulin? These are patients who are long-standing type 2 diabetics, and they are now insulin depleted, meaning that they have now symptoms which suggest that they require insulin, like they start to lose weight or they get osmotic symptoms despite being on maximum therapies. Mostly these patients are uh, treated with sulfonylurea's very high dose, which really burns down their beta cells, and they now are not responding, and you see their HbA1c rising each time you do their HbA1c. So these are the people who definitely need a basal insulin despite multiple therapies. So what you do is you can either give them a fixed dose, which is a set dose of 10 units, or you can work out through a calculation, which is body weight. So if you want to do it properly, then what you can do is, I'll give you an example of a 72 kilograms person. So the formula that we use is 0.5. So you multiply 0.5 with the body weight. So if we were to do 0.5 with a 72 kilo person, that will give you 36 units. Now this is the total 24-hour body's requirement of all insulin. So remember that this is inclusive of the basal insulin and the prandial insulin. So normally 50% of the insulin is the basal and 50% is the prandial insulin. So if we worked out that it is 36 units of insulin required in 24 hours, if you want to do basal, which will be 50%, so that comes out to 18. So half of 36 is 18. Now what we want to do is we want to make sure that we don't start patients high. We start very, very low, and we titrate it up. So we don't even take off 50%, but we take off 60% off. It's called the safety factor, to give you reassurance that you're not starting the full dose, but you're starting less than half. So that should give you quite a lot of assurance that there's no way you're going to overdose or cause hypoglycemia, because you're starting less than half of it. So take away 60% of 18 units will give you a number which is 11. So for the ease of administration, we round it down to 10, and that's how you arrive at a set dose of 10 units. If you're still worried, you can start with 6 units. So this is for a normal person which is over 70 kilos. If you have a frail elderly person, then you do not multiply with the 0.5. You can multiply by 0.2 or even less. In fact, I would say that for very frail elderly people, start the basal with 4 units only. And then the question is about how do we get the dose right. So most people get it wrong, and they don't know how to push the dose up and down, and they keep messing around with both the insulins. So basal insulin, remember that it always corresponds to the pre-breakfast, first thing in the morning, blood sugar levels. Nothing else will be used to titrate the dose. So don't look at any other readings other than the first thing in the morning, pre-breakfast. So, and we usually individualize the target. So for normal person who is young, adult, healthy person will be a set target of 5 to 7 millimoles, which means that if your blood sugar readings in the morning come up between 5 to 7, the dose that you've given is the correct dose. So normally, because we start with 40% of the dose, it will not be achieved. So typically a patient will say to you that first few days the blood sugar was about 14 or 15 after giving the 10 units, and you simply tell them that until they get to the target of 5 to 7, they keep titrating it. There are two ways of titrating: either keep increasing the basal insulin every night by 1 unit up until they wake up one day and they see that their blood sugar levels are falling in between 5 to 7, or you can do a bit gently, that 2 units every 2 to 3 days. So they increase the dose by 2 units every 2 to 3 days up until they wake up with a blood sugar between 5 to 7. Once they achieve the target blood glucose level, do not change the basal insulin level at all. There are a few things that you need to be aware of, that if for some reason they become hypoglycemic or they come with a blood sugar of less than 4 or low readings in the morning, all they got to do is go one step backward. So if they were fine with the 18 units before, and then they try to fine tune and tightly control it, and at the 20 unit dose they are coming up towards 4 and 5, they can always go back one step backwards. That's all they need to do, not like massively cut down the dose because of worry of hypoglycemia, because it will then have a pendulum effect and yo-yo effect. So we want to avoid that. So basal insulin is always titrated against pre-breakfast, first thing in the morning blood sugar readings. It is usually titrated against a target dose, normally of 5 to 7 for young adults and healthy people. And if it's frail and elderly person, then we have a slightly less intense regime, and we then say try and achieve single figures or get the readings anything between 5 to 8 or 6 to 10. That is also quite acceptable, especially if it's an 80-year-old or 85-year-old person. You don't need a very tight target for them. So I hope this helps you in initiating the basal insulin and how to work out the correct dose of basal insulin. Thank you.